Hi, welcome to Fit to Move Physical Therapy and Wellness. In today's pep talk, we're going to be discussing normal breathing versus dysfunctional breathing. Hi, welcome to Fit to Move Physical Therapy and Wellness. In today's pep talk, we're going to be discussing normal breathing versus dysfunctional breathing. It's been suggested in the literature that dysfunctional breathing is present in 5 to 11% of the general population and up to a whopping 83% in those who suffer from anxiety. So whether you're an athlete or someone who just likes to stay active, dysfunctional breathing can impact your total wellness. So why is this an important topic? Normal breathing can positively impact your posture, stability, and motor control. And most of this occurs because of the all-important diaphragm muscle. The diaphragm performs both postural and breathing functions. Disruption in one could negatively affect the other. The diaphragm is able to influence core stability because it regulates the intra-abdominal pressure needed to stabilize your spine. For example, research shows that individuals that suffer from chronic low back pain have issues with dysfunctional breathing. So dysfunctional breathing plays a role in the development and perpetuation of musculoskeletal pain. Last but not least, breathing regulates our mental and emotional states. But what happens when your breathing becomes dysfunctional? And who is susceptible to becoming a dysfunctional breather? First, let's define what is normal breathing. Normal breathing is diaphragmatic breathing that involves synchronized motion of the upper rib cage, lower rib cage, and your abdomen. Nasal breathing is the preferred method of breathing versus mouth breathing. And lastly, normal breathing involves a shorter inhalation period followed by a longer exhalation period, typically 2 to 4 times longer on the exhalation component. So what is dysfunctional breathing? Dysfunctional breathing is inappropriate breathing which is persistent enough to cause symptoms with no apparent organic issue. Patients suffering from dysfunctional breathing may have the following symptoms: dyspnea, which is shortness of breath, chest tightness, frequent yawning or sighing, which is a sign of air hunger, persistent musculoskeletal pain, hyperarousal, depression, anxiety, and sleep disturbance. So how do we identify dysfunctional breathing? Unfortunately, there's no gold standard diagnostic test for dysfunctional breathing, but there are several assessments that are effective at identifying those with dysfunctional breathing. Observational analysis. Look for a rib out flare. A rib out flare is essentially when you notice the rib pointing out and upwards. Next, look at the infrasternal angle, and this is the angle that meets in between the two ribs. So at the bottom of your rib cage, note this angle. This angle should be no greater or no less than 90 degrees. Next is a high-low breathing test. This should be done with you lying on your back. One hand will go on your chest and the other hand on your abdomen. Palpate for where you feel the movement. You should feel more movement in your abdomen than your rib cage. So the test would be indicative of dysfunctional breathing if there's more movement occurring in your chest versus your abdomen. The breath hold test. To do this, you want to take a normal breath in and then a normal breath out. Then hold your breath until you experience some sort of reaction, such as twitching or swallowing. And if anything occurs under 20 seconds, this would be positive for some component of dysfunction. Next, you can palpate for the presence of an elevated first rib. To find your first rib, simply put your hands on your collarbone and just go slightly above that into the shawl area or that little depression in the top of your shoulder. Basically, you want to feel left to right and see if you note one side that's a little more elevated than the other. If you do find one side that's elevated more, then this is also indicative of dysfunctional breathing. Aside from the physical examination component, you can complete a self-evaluation of breathing questionnaire. It consists of 25 items. Each is scored on a scale of 0 to 3. And a score higher than 25 is indicative of dysfunctional breathing. So how can one treat for dysfunctional breathing? Your first strategy should be to practice nasal breathing patterns. To do this, rest your tongue at the roof of your mouth, which opens your airway and prevents you from clenching your teeth. An easy inhalation followed by an exhalation that is 2 to 4 times longer, and a pause in between the inhalation and exhalation should give your diaphragm time to return to its normal resting position. Be sure while you're doing this exercise not to use your neck or back muscles. Next treatment. Bring your fingers up and under your rib cage. During the longer exhalation phase, bring your fingers further up and under your ribs. This should mobilize the soft tissues that connect into your diaphragm. Next treatment. Rest your fingers across your collarbone and then slightly bring them down. As you inhale, look up at the ceiling while drawing your skin down. That looks something like this. You can advance this exercise by adding in some rotation. Something like this. I consider this a good exercise to do while you're sitting at your desk. In today's pep talk, we cover the effects of dysfunctional breathing, the common signs and symptoms of dysfunctional breathing, and several treatment strategies. In closing, effective breathing strategies can help reduce the risk of persistent musculoskeletal pain and improve our physical and mental state. If you have any questions, please feel free to reach me at kenneth@fit2movept.com. Thank you for watching and have a great day.